promote the cultural values. We are the ones to guide the young ones, then moving to development and prosperity. We praise the Lord and thank the Almighty, for we are living and serving our nation. Let us unite to build the nation while aging with security and dignity.
The Ministry of Gender, Labor and Social Development, in collaboration with the Parliamentary Forum on Social Protection, is organizing yet another month-long event to showcase and celebrate the success and potential of social protection in achieving Uganda's national development aspirations. The Social Protection Month will be held in October 2024 under the theme Social Protection as an Enabler for Human Capital Development Across the Life Cycle. The Social Protection Month will be characterized by a series of activities, events, campaigns that will engage multiple stakeholders and the general public at both national and subnational level, culminating into a national dialogue to be held in Kampala. The national dialogue will bring together stakeholders from various sectors to discuss and advance social protection strategies and initiatives in the country. This year's Social Protection Month will have a strong focus on the potential of social protection to facilitate the achievement of the human capital development targets across the life cycle. The National Development Plan 3 and now the National Development Plan 4 under design recognize social protection as vital in addressing risks and vulnerabilities as realizing human capital development. Social protection coverage is still very low at only 3.1%, while only 0.3%, excluding healthcare, of the GDP is allocated for financing social protection. This is one of the lowest in the region compared to our neighbors Kenya at 1.4%, Tanzania at 2.5%, and Rwanda at 1.3%, all excluding healthcare as per the World Social Protection Report 2024-2026 by ILO. We want to believe that this year will be better than last year, because every year we have discussions with different entities and they support us, and because we have been working prudently, a number of other organizations have been coming in to support us to make sure that our agenda is achieved. Thank you so much.
Specifically coming to the question of health insurance as a social protection issue. Health and well-being is a fundamental human right. The state and partners have a right to provide for health promotion, disease prevention, treatment, and care services for our citizens. To provide these services, we need resources, sustainable financing to provide health services. Over time, we've noted that a significant proportion of our health programs and projects are supported by donors. And increasingly, the donors are facing fatigue, donor fatigue. Hence, the need for us as a country to mobilize and leverage domestic financing to provide health services for our citizens. One of the means through which these resources can be mobilized is by offering for our citizens a national health insurance. We want to thank the 10th Parliament for the initiative that was taken to process the National Health Insurance Bill that was forwarded to His Excellency the President. Unfortunately, the bill collapsed before the President ascended to it. As we reflect on social protection this month, it's also important for us to reflect on health protection. And within health protection, health insurance for our citizens. The bill has been brought back to the Ministry of Health for redrafting. Currently, it seems is at cabinet stage. I sit on the health committee. We look forward to ensuring that this bill is brought to Parliament for us to process, for us to be able to ensure our children, our young people, our men and women, and our older persons have access to health services through health insurance. In East Africa, Kenya has a national health insurance scheme. The Republic of Tanzania has a national health insurance scheme. Rwanda has, the DRC Congo has. It's Uganda that has not delivered to its citizens a national health insurance package. We look forward to having that as a Christmas gift for Ugandans. Tomorrow, we're told, we'll be commemorating the Older Persons Day. Last year, we promised for the older persons geriatrics care, which is treatment and care for older persons. Older persons, like children, have special health care needs. And all of us here present, sooner or later, will be older persons. They need specialized health care for their health care needs. Infectious diseases that affect older persons more, non-infectious diseases like high blood pressure, diabetes, cancers, and degenerative diseases caused by age require specialized services. The government of Uganda and partners owe the older persons a legal and regulatory framework, a law that ensures we provide for the healthcare needs for older persons. Policy and strategy that will ensure healthcare for the older persons is delivered up to the lowest level. Health facilities that are specialized and should be able to provide geriatric care. And this also requires ensuring we have geriatrics specialists that are able to provide these services. Older persons need specialized medicines like children, pediatric doses, as well as older persons' doses. We also need to work with the national medical stores to see to it that medicines that are specifically needed by older persons to treat medical conditions that affect older persons are put in place. In a nutshell, our healthcare system should be older person responsive. I am Dr. Boka Didi George, Member of Parliament for Bongi constituency. I also sit on the Health Committee of Parliament and a member of the Uganda Parliamentary Forum on Social Protection. I thank you. Thank you so much.